Now, in June last year, the Supreme Court of the United States overturned Roe v. Wade, the law that had made abortion a constitutional right for Americans for nearly half a century. It has opened the floodgates to much tighter restrictions across the country. Just this week, the nation's second biggest drugstore, Walgreens, said it will no longer distribute abortion pills, even in some states where they're still legal. Clinics, abortion providers, drugstores are being frightened off by the threat of legal action, which undermines critical care even when the life of the mother is at risk. Texas bars abortions except for medical emergencies, with doctors facing punishment of up to 99 years in jail. But it's becoming clear that doctors are now refusing the procedure, even in extreme cases where it is medically proven the fetus will not survive, for fear of prosecution. We've been speaking to Amanda Zurawski, one of 5 women suing the state of Texas. Also with her, Mark Heron, the senior counsel of the Center for Reproductive Rights, who are representing them. Amanda, you're 35, you became pregnant after 18 months of fertility treatment, and you're into your second trimester. What happens then?
Yes, so you're exactly right. It took a long time for my husband and I to get pregnant, and we were absolutely over the moon when we were. My first trimester was really smooth sailing and didn't have a lot of complications until just one day shy of the 18-week mark. I had some unexpected symptoms, and so I contacted my doctor, who had me come in right away, and very quickly was diagnosed with a condition called cervical insufficiency, which basically means that my body was dilating prematurely. And the baby, we were told, wouldn't be able to survive. Eventually, what happened was my water broke and I lost all of my amniotic fluid. And shortly after, my membranes ruptured as well. So unfortunately, she was not going to be able to survive.
That is an immensely traumatic moment for any woman. What did the doctors tell you at that point about aborting the fetus?
I asked what we could do to make sure that the next steps would be respectful for my daughter and for me, and to prevent me from getting sick. And many healthcare professionals that we consulted said that there was nothing that they could do because the baby's heart was still beating and I wasn't considered sick enough, or my life wasn't considered in danger. So under Texas's anti-abortion laws, they couldn't intervene.
So at what point did that change? I understand that at some point along the way you then developed sepsis, so that you were eligible for this procedure, but that he wouldn't have done anything were there not a threat to your life. Is that what you're saying?
Exactly. So they couldn't intervene, they couldn't help, they couldn't provide standard health care until either the baby's heart stopped beating or my life was considered at risk because I was sick enough. And for me, it took 3 days, and in a matter of minutes, I went from healthy to septic. And so at that point, our doctors, after consulting the ethics board at the hospital, were permitted to give me health care.
Mark, let me bring you in at this point. Are they reluctant, these doctors, because they don't believe in intervening, or are they reluctant because they're so worried about the legal repercussions?
So doctors across Texas, and in fact across the United States where abortion is banned, are understandably afraid to provide the health care that they would have provided last year. In Texas, an abortion provider or a physician who provides an abortion procedure to a patient under the medical emergency exception, if the doctor is wrong, they face prosecution for up to 99 years in prison, hundreds of thousands of dollars in fines, and loss of their medical license. This would be devastating to any physician. And so what we have done is we have filed a lawsuit holding the state of Texas accountable and asking the courts to provide clarity so the doctors can understand when they can provide treatment and when they cannot provide treatment. Because what is happening to patients like Amanda, it's just the tip of the iceberg. This is happening to hundreds of patients Amanda and the other plaintiffs in our lawsuit are brave and have been willing to step up, but it's understandably very difficult for others to do so.
Amanda, I want to apologise because I referred to your child as a fetus because it was in the early stages, but you referred to her as your daughter. Can you talk to me about the emotional trauma that is involved in this for so many women who are going through the same thing?
Yes, you're right. I do refer to her as my daughter. She is my daughter, and her name is Willow. And I think something that a lot of people in the United States don't understand about abortion is, number one, that it's just standard health care, and number two, that a lot of times the people that want or need or seek an abortion are not what the stigma has represented us to be. I desperately want children. I desperately wanted Willow, and yet I found myself in a position where I was waiting for her to die so that I wouldn't die. I can't imagine a more traumatic or anguishing experience than wishing for one of those things to happen. But that's the reality of being pregnant in Texas today.
Just finally, what damage did this do? Are you still able to have children?
We hope so. We will have children. We will have a family someday. We're not sure exactly how we're going to achieve that. We know one thing for sure, that what happened to me is going to make it medically even harder for me to get pregnant again, if I can. But like I said, we will have a family one day, one way or another.
Amanda, we're keeping our fingers crossed for you. Thank you very much for coming on the programme. And Mark, thank you very much as well. Thank you.